Can adrenal fatigue syndrome happen in adolescents? I'm Dr. Carrie Lam. This is Dr. Michael Lam. We are nowadays seeing more and more children and adolescents in our coaching program. So we hear this question a lot. So have you seen and have experience with children or teenagers having adrenal fatigue?
The answer is unfortunately much more than I like to see. And oftentimes, there is a familial history. It's almost like weak mothers give birth to weak child, and these events don't show up until much later. So oftentimes the parents doesn't know, the kids doesn't know until they come to the teenage years, and that's when the first signs and symptoms appear.
And what are some signs and symptoms of maybe a child or a teenager having adrenal fatigue?
The most common is the lack of energy, inability to concentrate, sleep issues, appetite issue is not too bad. These oftentimes can be worsened after exercise, especially if they're in an intensive sports type program. So we see that quite often. Teenagers nowadays are exposed to a lot of stress, especially high achievers. And we see that quite a bit in people with straight A students doing well in school and then kind of over time fall apart, so to say, which is very concerning because these are teenagers that are on track to become very excellent students in college, it seems to me.
So also people like teenagers are high schoolers that are competitively in sports, right? They really strive to do well in their competitions, and that high stress can also lead more to the fatigue and the irritability that they might be in.
Yeah, and the sad part is that this is seldom not recognized by regular pediatrician. And after exhaustive studies and laboratory tests, they are often sent home and say there's nothing wrong with them. And these adolescents, because in that age group, the peer pressure is so great. So they're always torn between having to, see their friends go out and then they kind of stuck at home, etc. So it can cause a lot of emotional turmoil. And if the family doesn't understand these ramifications, things can actually can be very negative, it seems.
So what can a parent do if they suspect or they really think that their child has adrenal fatigue?
Well, the first thing is obviously to see a pediatrician and make sure that from a medical perspective that there's nothing uncovered. You don't want to jump to conclusion. But if your pediatrician has given a clean bill of health, then and if the teenagers still have these issues, the question is why, and you have to start looking history. What is really going on? Is it food driven? Is activity driven? Sometimes teenagers are trying so hard, but yet at the same time they are not able to match up to their peers. So these are all things that a parent, if you are astute and pay attention, you will figure out that something is wrong, even though you cannot put your finger on it. Something is just not quite right. We see a lot of the parents that call me for that reason. And then you'll be surprised how often these things happen. But the good news is that because adolescents tend to be young,
they're multiple,
and they have a lot of reserve. So they tend to bounce back relatively quickly if you do the right thing. But I always tell the parents that the dangers is that if you have this type of issue, you can bounce back, but you have to do it right because you have to plan for the rest of their life. And if you're not careful, they can always relapse back, and that is a danger, and that's not fun.
So if you are concerned about your child or your adolescent having adrenal fatigue, you do need help, and you should find someone who knows what they're doing in order to help them through the adrenal fatigue. And so we're here to help you and empower you on your health journey if your child or your adolescent might be dealing with this adrenal fatigue.